Should I, can Bambang help me just, yeah. Okay, I'll start this webinar. So I will, we will do our discussion today on the topic of protecting elderly amidst COVID-19 pandemic. I'm sure everyone is in it at the moment and might feel too affected by COVID-19, but today our discussion will be focused on the aging populations, elderly people, and we will have our 4 speakers here, who currently, those who speak microphones and videos are active, and staff of Prakarsa. So this is a Prakarsa talk series. It's talk number 12, and I will further give an opportunity to Mr. Ahmad Tuhan, the executive director of Prakarsa, to say a little bit about Prakarsa talk before I will continue to introduce our speakers today. Mas Maftu, please.
Thank you, Mbak Ria. Good afternoon to all participants, and of course to speakers. And welcome to the Prakarsa Talks number 12 today on protecting elderly amidst COVID-19 pandemics. My name is Ahmad Tuhan. I'm executive director of Prakarsa. Prakarsa is the NGO think tank based in Jakarta, Indonesia. We focusing on 3 big issues. The first is a social policy, the second is fiscal policy, and the third is sustainable development policies. We founded by researcher, think tank, researcher, activists, journalists, and development actors since 2004. So we are quite young compared with other think tank in Indonesia. During the COVID-19 pandemic, Prakarsa has tried to provide and disseminate knowledge sharings, knowledge dissemination regarding main issues that we need to focusing on, including citizen welfare, health services, and economics issues. For elderly, become a main topic Prakarsa since 2 years, 3 years ago. Viral infection can cause more severe symptoms. Sorry, interrupted by my son. People who manage to overcome or the immunal problem, the elderly in this disease can lead to death. And as we know, based on a lot of observation, most deaths occurred in COVID-19 patients who rotated 80 years and over, with percentage reaching 14.8%. Is quite high compared with young and adult people. So the webinar has attempted to discuss a variety of measures taken by government, not only Indonesia government, but also other government, Australia, maybe Philippines, maybe or others, particularly to focusing on social protection, not only how to caring elderly, but also how to improve a cash transfer for elder people, because it is very important to make sure elder still have a power on economic aspects. So purchasing power, carrying power, and so on. So I hope the webinar can a medium to share on elderly policies and how to develop a policy option to strengthen elderly condition during the COVID pandemic. So all the more so, thank you all for coming today, especially for speakers, Professor Peter, also Miss Rochelle Aqualin from the Coalition of Services of the Elderly, also Miss Dia Larasati and Herni, and also Victoria Pangidai. So once again, thank you to all of you for coming today. Enjoy the webinar, and see you in the next Prakarsa Talk series. I wish all of us keep safe and stay healthy. Thank you. Over to Maria.
Yeah, thank you, Mas Maftu, for your introduction on Prakarsa and this Prakarsa talk series. And I will start our discussion by, again, thank you everyone for joining us today. And I will be introducing our panel of speakers today, which consists of, as you have seen probably in our flyer, Professor Peter Whiteford from the Australian National University, based in Canberra. So I will read the short bio of the speakers. Professor Whiteford, Peter Whiteford, is professor in Crawford School of Public Policy at the ANU, and he's used to work at the Social Policy Research Center at the UNSW in Sydney, and previously he also worked as a principal administrator in the Directorate of Employment, Labor and Social Affairs of the OECD in Paris, which encompassed pension and welfare policies in OECD countries, including Eastern Europe and China. So your expertise will be very fruitful for us today. And Professor Whiteford also is an associate investigator with the ARC Center of Excellence in Population Aging Research, CEPAR, and honorary professor in School of Social and Behavioral Sciences in Nanjing University, China. So welcome, Professor Whiteford, to the panel today, and we will hope to learn much from you, from your international exposure to the issues of aging population and welfare policies, which is very much the core objective of the discussion today. And our the next speaker is Ms. Dia Larasati. She's currently is a senior social protection policy specialist and advocacy expert at the National Team for the Acceleration of Poverty Reduction, TNP2K. You know, Indonesians, we like all this abbreviation. Miss Dia oversees internal and external discussions on social protection policy and programs, including with ministries, social protection experts, stakeholders, international organizations, etc. She has been working in this area of social protections and education since 19 and her expertise including educational reform, child labor, youth employment, migrant employment, CCT, and life cycle social protection system. So this is very much relevant to our discussion today because life cycles, starts from your first 1,000 days up to when you reach over 60s, over 70s, then you are included in this as aging populations, and Miss Dia's task in the NP2K, including overseeing these issues. So welcome, and thank you for joining us, Miss Ibu Mbak Dia Larasati. And our third speaker is Miss Rochelle Agualin. She's a project officer of COSE, Coalition of Services for the Elderly. It's a non-governmental organization based in Manila. She's the project officer for promoting financial security of older women in Southeast Asia, Pro Older Women Project. She's been with the organization since 2017. So do I see Miss Dia here? Miss Rochelle? Is she on the video?
Yeah, I think she's here.
Ah, okay. Okay, welcome. And we would like to learn from your experience in the Philippines. You can share with us and also with the Indonesian, with our Indonesian college here. And our last but not least is Miss Herni Ramglaningrum. She's the now program manager and research manager of Perkumpulan Prakarsa. She works a lot on policy design and impact of policies on equality and welfare. Her research interests including social policy, gender equity, health, employment, and sustainable development. And Herni also a research associate at Frederick Ebert Stiftung and part of Feminist Network Asia. Herni is, I think you might have known, graduated from the ANU. So that's how you see the connection here. She graduated from public policy at the ANU, and currently she's engaging with several national and international coalitions such as National Decent Work Coalition, Universal Health Coverage Coalition, and Tax and Fiscal Justice Asia. So welcome to our speakers, welcome to this panel, and I hope we all will enjoy the discussion. I will also share with you the time allocation. It's now 1:18. We will have our speakers talk for 10 to 15 minutes each. Starting from Ms. Herni. Ms. Herni will present Prakarsa's research on elderly welfare, which was undertaken in 2019, so it's last year. And the research just fresh from the oven. I think they're finalizing the final report now, Herni. Yeah, so this discussion will also give inputs to Prakarsa on how to use the results of this research, and also the policy brief, which also needs the contribution from this discussion. And after after the 4 presentations, I hope you will take notes of what you need to ask to each of this speaker. So we will have question and answer session in the end of the last presentation. And you can use the raise hand feature on Zoom, but if that is, if otherwise, you can just like raise your hand on your screen, and I and the team from Prakarsa will note that. And in the last resort, you can also use the chat window on Zoom. Okay, without further ado, I will give the opportunity first, and time and floor I will give to Hernie to start the presentation, a maximum of 15 minutes. So it's 1:20. We'll finish at maximum 35.
35, okay.
Yeah, okay.
So, are you going to share my slides or should I do
Yes,
that?
sure. No, I can do it from here.
Okay. Thank you, Karya. Thank you, everyone, for attending the webinar. Thank you very much for Professor Whiteford, for Badia, and for
Wait,
Mr.
sorry.
Shah. Such an honor for me to be one of the panelists here, especially with Professor Whiteford as one of my favorite lecturer in the university. So despite I don't have a specific presentation on coronavirus 2019 in here, I will in general talk about the research result that Prakarsa has been conducted last year. And then we plan to disseminate the research this month, but unfortunately with the current situation, been done it, and then we have modified the dissemination into other type like what we have now, discussing how the nationals and the government protect the elderly amidst the COVID-19. However, please allow me to kind of elaborate the general situation that has been particularly to the elderly since the outbreaks occurred last year. So the first slide, Karya. Next, please. I would as we have known that the data from China shows that elderly people aged 60 years and over are the most vulnerable group to COVID transmission. The elderly group has weaker immune system, therefore they are more vulnerable, and they often to have congenital disease such as heart, lung, diabetic, and kidney disease. And then we've also seen that as 11 February, the data shows that 44,000 something elderly positive in China, and then the mortality rate for the elder group is higher than the other group of age, which reaching 15%. Next slide. For the context of Indonesia, the percentage of elderly population currently reach almost 10% from the total population. So it's equivalent to 25 million, and it is continue to increase every year. In some areas, the elderly population is higher than the national average number or average rate. In Yogyakarta, for instance, the population has reached 15%, almost 15%. In Central Java, 13%. In Java, 12%. And then in 2019, the elderly household also reached 27%. It is almost 28%. This data is referred to the national data that published by the Indonesia Statistic in 2019. And then the a quarter of elderly population in Indonesia are unfortunately smoke, and the elderly men, almost 50% of the elderly men are smoking compared to the 2% of female elderly. So we've heard that this smoking habit is also exacerbate potential fatality rate of elderly when exposed to COVID-19. So in general, the social protection for elderly in responding to COVID-19 has taken by the government several measures to prevent the economic impact that has also been taken by the government. However, we haven't seen that the elderly group is clearly mentioned by the government as the prioritized group by the government. Next, so we want to see how this can affect the elderly in Indonesia, and then we want to also elaborate the situation of elderly based on our research result that we conducted last year. From this research, we can see that how the elderly population is very vulnerable, even though without the situation of the outbreaks. So last year, we, with the support from the HIFOS, one of the donor, conducted a research on the elderly. This research is part of our policy advocacy work to provide a valid evidence base, and then from that we would like to propose a better policy to the government in related to the elderly protection. And then the research objective is, first, actually we would like, at that time we wanted to study the different policies in different across Indonesia, and then we also want to see what sort of national policies that the national government have implemented. And then we also see we assess the situation of well-being of elderly in the household level, and we want to see the gender roles within the families in related to the elderly care. And the last objective of the research is we would like to review the social protection policy that provided by the local government and its impact to the welfare of the elderly and the families. So the methodology that we use to conduct the research is mixed method, quantitative and qualitative. Quantitative in a way we conducted a survey in the 6 cities across Indonesia, and then we engage 1,400 respondents who are coming from elderly population or age 60 above. So the area that we have researched are in the South Tangerang. South Tangerang is a city in Banten, the western part province next to Jakarta. In South Jakarta, in Kediri. Kediri is one of the cities in East Java. Pacitan is also one of the cities in East Java, and Polewali Mandar, one of the cities in Sulawesi Barat or West Sulawesi. And we are also interviewing the national level respondents coming from the Ministry of Social Affairs, from TNP2K, and from other government agencies. Next. So, however, the research is not completely done yet. We are still finalizing the report, but we can explain, so far we have found very important findings from the research. First is the elderly are commonly cared by the female family member, by the daughters-in-law, sister, or niece, and then most of them are actually coming from vulnerable economic situation. They have limited access to health services, and then when they have access to the health services, they mostly accompanied by female family member. Apologize for the percentage here. It is not 23%, but it is 45%. I haven't made a correction yet in here. And then we also seen that the access to clean water of the elderly population is very low. It's only 26% of the respondents are able to access clean water. And then access to TPS. TPS means their participation into the general election. So less than 20% of elderly in Indonesia were participated in the national election. And then the other interesting finding we found is elderly people who live alone or far from relative and even no longer have a close family become a responsibility of surrounding community. So this might be driven by the socio-cultural values in Indonesia. So usually the head of the village will also responsible, and then they will also share the responsibility to other community members. The last finding is that the majority of elderly who do not have assets, such as they don't have place to live, they wish to live together with other elderly, this is not a common culture in Indonesia. Most people in Indonesia tend to think they want to live with their children or grandchildren or other families member other than with other elderly. And then with other elderly mean that they are expecting to have alternative place to live, such as nursing home. However, facilities such a thing is not affordable in Indonesia. Next, so we are measuring the elderly well-being through the perspective of OECD well-being of human. So we extract the component or indicators of human well-being into this analysis, and then some of the component I will explain later on. So the first dimension that we've seen and based on OECD framework is health dimension. So from our finding, we have seen that only 46% of elderly in Indonesia has access to healthcare facilities. Even though Indonesia has implemented universal healthcare coverage program through the JKN since 2014, unfortunately, only 46% of elderly as our respondents answered that they have the access. And more than 50% of our respondents explained they do not have access to health facilities. And then next is in related to the social connection dimension, we've seen that the participation of elderly in the public activities or in the policy decision-making process in the community level is very low. In the rural area, less than 30% of elderly participate in the activities of policy making process, and then only 20% are participated. While in the city, we divide it into 50%, 50%. While in the city, their participation even lower than in the village. From the dimension of skill and education dimension, the elderly with lower education background mostly work as a farmer. They earn very low income, so more than 35%, the majority of the respondents earn less than 500,000 rupiah per month. This could be equivalent to $50 Australian per month. And then only less than 1% of respondents explain they earn more than 5 million rupiah per month or 500 Australian dollar per month. And in the perspective of participatory dimension, this is specifically on participation on general election. The participation of elderly is very low. It's less than 50% of them are actually participating. The reasons that we found from the in-depth interview during the research are actually they don't have anyone who accompany them to the election place. And second, most of them thinking that election is not their responsibility, it's goes to younger generation responsibilities. And then for the housing condition that we found from the research, we've seen that inadequate housing condition can affect physical and mental health condition. So we divided this housing condition into three sub-dimension to the roof, situation, floor, and the wall. So yeah, we found that 60% of elderly or our respondents are living in the house where they have a roof tiles. However, in Mamuju and Poliwali Mandar in the West Sumatra, Sulawesi, sorry, the majority of them are actually using the zinc as the roof. And then for the floor, 56% are living in the house where ceramics is installed, and then 31% of them are living in the cement floor house. But yeah, most of the elderly have good house floor condition from this estimation. However, from the wall, we've seen that majority of the respondent use plaster and then the bricks. And this can also be concluded that the situation of the house of the elderly is not is quite good, considering the utilization of the floor and the wall. We also calculate the government since January 2019 decided to reduce the PKH for elderly, to reduce the coverage of PKH elderly. Previously, the recipient of the PKH are they are who actually coming from 40% the lowest economic level, age 60 years old to 60 years above. But then the regulation, the new regulation that the government enacted was actually the elderly who age below 70 are no longer benefited from this program. So those who are aging 60 to 69 are no longer recipient of the PKH. And then we want to see the impact of this reduction. So may I explain a little bit about what is the PKH, even though I'm sure everyone in here already understood what the PKH is. The PKH is a social assistance program addressing household in the poor and very poor, implemented by the Social Affairs of Republic Indonesia. In 2017, the PKH program introduced additional precondition in the form of assistance to beneficiaries with disabled household member as well as elderly. And condition of PKH are elderly are poor and very poor, and the beneficiaries are over 60 years old initially, but it has been changed now. Based on the national data on 2018, the number of elderly who receive PKH reached 864,000 something. And then what is actually the impact of the age limitation from 60 above to 70 above? So,
Bluetooth mode.
Okay, I think I've been warned about my time constraint. I will be quick here. So, based on our estimation, the average per capita income after the age limitation decreased by 57,000. So I would skip this to maybe the page 19 to show what is the impact of the reduction of PKH to 70 years old above. So we've seen this, we estimate this with the propensity score matching analysis method, and then we see the common support to calculate this. Then after that we estimate and then the estimation is made to calculate the difference between average income of all individuals who receive PKH elderly with the same average income of individuals if their PKH is cancelled. So the calculation is in the table page 19, slides 19, I mean. So we've seen here for the elderly with the PKH status, for those who are not receiving the PKH and for those who are receiving PKH. We've seen actually the reduction of the age limitation of the PKH has impacted both the recipient and non-recipient. However, for the recipient, the impact is higher than those who are not receiving the PKH. The positive side of this, we've seen that actually PKH for elderly have been addressed to the right target. So the error, the mistargeting of this PKH elderly is very minimum, as we've seen that the impact to the recipient of the PKH is higher than to those who are not receiving the PKH program. However, even that, the non-recipient of PKH still impacted if the government reduce the age of PKH recipient. So we've seen here the gap of income per capita between recipient and non-recipient is 25,000 rupiah. This is equivalent to 2.5 Australian dollar. And then income per capita, the gap income per capita between recipient and non-recipient, if the age limitation is applied, is 57,524 rupiah, or equivalent to almost $6 Australian. So the reduction, we calculate this from the amount that the elderly receive per 3 months, amounted 500,000 rupiah, and then if it is divided divided by per month. So per month, elderly basically receive 167. And then this 167,000 will be significantly affected those who receive the PKH by 38,000 rupiah per month per individual or per head. So our proposal, based on what we've seen from the well-being dimension and then the reduction of the PKH, is in general, we propose the government to prioritize and expanding the scope of PKH assistance for elderly, cancel the age reduction or age limitation, and then provide the universal PKH program for every elderly above 60 years old. And then we also propose the government to provide universal pension scheme, because we've seen on the previous slides that the income of the family, of the household of the elderly, is very low, dominated by those who earn only less than 500,000 per month. And then regarding to the COVID situation, the government should provide universal cash and non-cash assistance to all elderly, given the existing data in Indonesia is very unreliable and potentially mistargeting if we only select a number of elderly. The social protection during pandemic era comprehensive. The hook and fish are two components that are important, and both must be provided simultaneously and in sufficient amount. So our proposal to the government during the COVID-19 are into scheme. First, we would like to propose a minimum scheme if the budget constraint is occurred. The minimum first choice is for the government to provide assistance program cash corona. We call this Batuna, targeting 10 million poor people. So this is every poor people in Indonesia receiving this cash transfer from the government, valued 2 million rupiah per month. In total, this scheme required 120 trillion funds. And then the minimum, however, if the government really want to prevent the social impact situation from this pandemic, we also have estimate the optimum scheme for the intervention or measurement. We call it universal income for the period of pandemic situation. So this universal income intended for all citizens of productive age, 15 to 64 years old, and for elderly citizens. The total recipient would be 203 million. Of course, this is a huge number. And then the government might have a problem in providing the fiscal. We don't have the fiscal capacity, but in the minimum way, at least we can provide a minimum skill by providing program cash corona for all 10 million poor people in Indonesia. So I think that that's all from my presentation from the our last year research, and then how we actually connected the research result into the current situation, and then also about our proposal. Thank you very much.